session 3 of our 4 sessions, Show Me the Money, which is all about accessing MAC funds for brain injury services and supports and employment. Once again, I am Maria Crowley, and I see Jill Farrington right up there at my left corner. We are going to do some state reporting out and talk a little bit about some strategies as we go today. Welcome back. You should be familiar with this information by now, but there are accommodations that are available. Captioning services are currently plugged into today's session, and if you need anything else, you can certainly contact the DETAC team. Speaking of which, thank you, Rebecca and AOD DETAC, for hosting this series. Excuse me. Just a reminder again of our ground rules quickly. And the two of us, Jill, I'm just moving us along here. We won't have Ami today, but Steve and Andrew and Peggy are on with us, which is great for you guys because they are the true subject matter experts. And this is a list of today's objectives. We're going to start out with some very brief Q&A for you guys to jump in on. And then we're going to move towards our state status reports, which is going to be your turn. We'll talk a little bit about reimbursable and non-reimbursable activities and some reminders there. Then we're going to hit on some additional key messages and strategies that Andrew and Steve are going to share with you. And then we'll talk about what's going to happen after this with next steps. So that's just a framework for what we're going to do today. And I'm going to turn it back over to Jill.
Okay, thank you so much, Maria, and welcome everyone. We're glad you're here. In between sessions, we've had a few questions that have come in, and we wanted to bring them to the full group's attention because there may be a similar area of interest on your part. And so I will read the questions, and then I'll ask HCBS Strategies to just say a few words, just so that we're all on the same page about these areas of some particular interest. So the first question that came from Colorado was, what are the financial money flow options? Colorado's curious whether the money should flow through the state agency, Office on Brain Injury, or should it flow straight to the community-based organization that provides direct navigation assistance to people with brain injury? Or does it get monitored and flows through the ADRCs and the AAAs? So it's getting into some level of specificity, and we welcome an answer to that question.
So it really, it's going to be dependent on each of the states. In Nebraska, I can speak to how that works in Nebraska. So they have, in Nebraska, they started out with a model where the each of the partner organizations contracted with one of the AAAs. So the funds flowed from the AAA, from the state Medicaid agency to the state unit on aging that oversees the AAAs, then down to the AAAs, and then each of the AAAs had a contract with the partner agencies. That was found to be very administratively burdensome for the partner agencies. They were having to pay an admin fee to the AAAs to administer that, but it prevented the state from having to have contracts directly with the partner organizations. Now they have contracts directly with the partner organizations in addition to the AAAs at the state unit on aging that operates MAC. And so that is something that they found to be very successful, but they are also, one, willing to oversee and manage those contracts. And then two, they have our team that is completely administering the time study and overseeing the time study, completely overseeing the cost pool, and summarizing and managing all of those different entities. Their responsibilities are really limited to, you know, the oversight of the contracts, the annual visits to each of the contracted agencies and things like that. And so it's gonna adding the additional layer of having it go from Medicaid to the state unit on aging and then over to the brain injury organization. That adds the additional layer, but it prevents Medicaid from having to have a separate kind of setup and work and fund flow. But it also is something, is that going to be what your state Medicaid agency is willing to do? It adds an additional layer of complexity to have it go either direction, but is it necessarily that if it goes from you or from the State Union on Aging over to your brain injury network, and you're able, that gives you the ability to do some sort of set aside pot if you'd like to, if you have 10% of the fee of what's going to be reimbursed to the local agencies set aside, so that way you can administer some new programs, or you can do some pilot cases or whatever you want to do, and then you distribute those funds out. It's really going to be state dependent. There's a lot of flexibility that can occur. It just really depends on what the state has the willingness to undertake.
Thank you very much, Andrew. The next question is just kind of talking a little bit about the workload to manage the process of Medicaid administrative claiming. This was also from Colorado, that they have a entire full-time FTE in the office that manages this for the AAAs. And she wanted to know, will we need to hire another person potentially?
And again, speaking from the perspective of Nebraska, they have a State Union on Aging fiscal team member that oversees all of the contracts. They verify what we the time that they spent on this each quarter is probably less than 10 hours because we're managing their workload and everything. And so if the state is going to see an admin study, adding the partner organizations on initially is a lift. But then if they're participating in the same time study, they're participating in the same cost pool documentation, it's really just adding new agencies to the existing methodology. So it doesn't have to be an overly complex ongoing, but it's definitely going to be a lift to get those agencies onboarded, make sure that your coding schema is reflective of their operations, making sure that they understand how to do the cost reporting. And so that kind of technical assistance will certainly be needed at the beginning, but then if you're just adding them to the existing infrastructure, you should be able to continue to manage with what you have. But in the case of Nebraska, like I mentioned, because they've contracted out the responsibilities of the time study and the cost pool, their state team, it is a very small portion of a single FTE that they're having to devote to overseeing MAC.
Thank you again. The last question is a little bit broader, and that is about the type of check-in guidance TA that might be accessible or available between today's meeting and the next time we come back in late August. It's about a 6-week period where we're hoping states are able to have some appointments with those key decision makers in your state, or depending on where your state's at, that you're able to continue to move things along and come back in August with a pretty good action plan or roadmap of what you see happening next. So I'd like to know if one of you can speak to what kinds of TA guidance could a state ask for between our session today and the next one.
And so Steve and I have mentioned several times that we are HCBS Strategies is a mission-driven company. So we are committed to anything that we can do to support the system, make the system more sustainable and more accessible for all individuals. So we are willing to kind of meet to help develop, to meet for an hour or two to develop what the next steps are. If you'd like us to be in an initial meeting with your state oversight agency or something like that, we're willing to donate our time to be able to make that happen. And then beyond that, would this be something where more assistance is going to be needed and have those conversations? But we're happy to provide at least some initial question and answers and support.
That's very helpful. Thank you. I'm not seeing any other questions that have come up in the chat. Take a quick look for any hands raised, but I think we may be about ready to move on to our next topic. We have a lot to go over today. In the chat are the topics that the states were asked to speak to about where your status is, essentially. So those are listed over in the chat. You can, certainly reference them there. Some of you have turned in a little summary in writing. We'll look to the states that are ready to make a status report to do so. We hope that everybody is, but we also know that there may be a couple of states that have kind of put a pause on their process, and that it may not be as applicable. We want to be flexible with this next section of presentations. So I am also going to put in the chat the states and we're just going in alphabetical order. And that way you all can just kind of gear up and know that you're coming up next. We can certainly try to facilitate some of those transitions, but you can feel free just to dive in. Those states are listed in the chat. So in a minute, I'll turn it over to you, April, from Alabama. I also just, from a timekeeping perspective, thought that what I might do is, if you see an applause emoji come up, that might mean that we're ready to probably move on to the next person, only so we have time for all of our agenda topics today. So hopefully that'll just be a helpful reminder that we're needing to kind of wrap up on that presentation itself. So 2 to 3 minutes is completely fine. And April, if you're ready, I'll just hand it over to you.
Sure. So good afternoon. We have made a lot of progress here in Alabama. I think the last update that we have was that we were trying to find someone to talk to. So between then and now, we've had great progress. We have looked into Medicaid right now. Our Medicaid agency is our no wrong door holder in our state, and ADRC applies for that funding, but we don't necessarily have to go through ADRC. Our Department of Education also is a MAC funding not provider, but they receive MAC funding from Medicaid. They provide directly with them, and they also have a private funding group who helps them do that. We have an appointment coming up between Alabama Department of Rehab, where our TBI program is within, and our own accounting office. And it's coming up in the next 2 weeks to get a game plan together. What we found out from last time was we corresponded with them, and we realized that we were already billing Medicaid. We had some MAC funding already going on within our own department, within our independent living program, and we request case management time logged, and our accounting also completes a quarterly cost report for admin time, and it's already captured in our case management system that we have with Voc Rehab. So that was very positive news. So we do have a guide to go on. The barrier, we didn't really hear or find a state in the South that has not expanded Medicaid yet, that we could talk to for a model. So we're still looking for that, to pull some data in from that. And also, we had David conduct an in-depth analysis between last meeting and this meeting, and we looked at the analysis looked at no wrong door policy in our state and potential application for our department to apply for, and those activities and what they were. We pulled breakdown of potential no wrong door activities, corresponding to time study codes, and allowable cost, along with additional information to provide to our own accounting folks and to Medicaid for the MAC funding. So we've got a pretty big analysis looking at what we would like to build. There was around 7 or 8 areas we think we could pull, but there's a total of 10 possibilities that we could pull right now with what we're doing between our navigation system and our care coordinators. Sorry, you heard the doorbell. So with that being said, that is Alabama's. We're really excited now. We would like to meet with AMI again, but we can meet with other folks as well. But we're going to jump in with our own accountants, get a game plan, and go to Medicaid and see what they say from there. So thank you.
Tremendous, April. So much happening, and so much to be able to hear about the next time we come together. So it was somebody like from California like to go next.
Katie, I see you're on. Are you wanting to report out?
I will do my best, and I see that Regina is on the meeting with me. So yes, so hopefully Regina can pop in. So my name is Katie. I'm from California. On the call is also Regina Catamarti. She's with Department of Rehabilitation here in California. And I will do my best. I've been on vacation for the first 2 meetings, but trying to keep up to date with the slides and the homework and those kinds of things. So, and I believe Tanya was able to attend some of the previous meetings and she's on vacation this week. So she and I will connect next week and kind of get everything in line. So my current understanding in the state of California is our Department of Aging is our state Medicaid agency, and they have already started developing the MAC with some of the ADRCs. So my goal is to reach out and figure out who the contact person is within the Department of Aging to see if we can get the TBI sites included in the conversations that are already ongoing with the ADRCs. Regina, is that information accurate to your knowledge?
Yes, thank you, Katie. And so thank you. And Tanya is our staff, and Matt also joined these calls. And the information that you reported is accurate. We have reached out to Department of Aging. They do MAC, and so we wanted to get a representative to provide a presentation to our advisory committee. And then also, in our Department of Rehabilitation, we don't do MAC training. So this is a learning time for us. And we really just appreciate this forum to help us move this way. We could see tremendous benefits from this. So thank you.
Great. Thank you.
Thanks, Regina.
Okay, it looks like we are anticipating for scrolling down for Colorado to go next.
Here we are. And I believe Kate is on this call as well. Hi, everybody. My name is Russia Nauer, and I'm with the MindSource Brain Injury Network in Colorado. And Kate Kirkmans and I have been attending these meetings, and Kate is the director of the Brain Injury Alliance in Colorado. Since this has all started, I've met with Andrew and Steve and learned a lot about MAC funding in Colorado and have figured out who the point person is for that in our state agencies. In Colorado, we have two different state agencies, one that actually provides the services to the clients, which is the Colorado Department of Human Services, and the other one that handles all the Medicaid funding, which is the HCPF, which don't ask me what that stands for, but they deal with all that money and then they give it to us. So I have figured out who in our office oversees the MAC funds that get distributed to the AAAs and who at HCPF oversees stuff. And we have a meeting scheduled to talk about how do we scroll in there. Thank you, Jill. It's healthcare policy and financing. The big thing is, if we want to expand, we need to wait about 18 months before we can bite this off. So what I'm trying to do is sell that we're not going to expand. We're just going to add on to what they already do and build BIAC in as a provider for what is already existing. And that seemed a little bit more palatable to them. The idea being we'll do that, and then in 18 months or so, we'll work to expand things. So we're trying to do a yes and situation. We'll see how far I get. I am tenacious. I'm not going to stop. I want this Medicaid dollar coming in. So anyway, thank you for everything. And Jill, thank you for asking my questions. Or answering my questions.
Yeah, absolutely. Thank you, Russia. And we'll go on to Florida next.
Thank you. My name is Danny Armington. I'm representing the state of Florida. And this is an investigative process for us. I represent Brain Injury Florida, which is a statewide advocacy group who are just initiating a ACL statewide partnership grant with University of Florida. So they're certainly engaged in this process. And we've also attracted the Department of Voc Rehab or Voc Services, as well as potentially the Bureau of Exceptional Students through the Department of Education, as we understand that they are currently claiming through that department. So as I mentioned, Brain Injury Florida is less than 2 years old in terms of this process. So we're just getting our feet wet in terms of this process. So when you talk about our MAC point of contact, we're still not certain. We know that it's flowing through the state Medicaid department, but we also understand that the statewide ADRC is involved in this process as well. So we've got contacts. We're just through the process of trying to make contact with them. In terms of efforts to date, we're still trying to understand the claiming process. It's unique, and we recognize that. And again, so far I haven't found anyone in the state that has experience with that, but we know they exist. So we're going to persist. We're attempting to identify that appropriate point of contact and strategizing on best application of MAC funding when we get to that point. Current barriers, again, clear understanding of the process, a definitive plan for application, and again, finally meeting that point of contact. In terms of ideas for improving employment, I think we are in agreement that we currently, through our grant, are focused on resource facilitation or neural resource facilitation. We've contracted with 4 individuals to begin to provide those services. I can say that they're very engaged and doing a great job, but this is a big state, 24 million people and about 700 miles long from top to bottom. So we've got a lot of geography and a lot of people to respond to. So we think that it would be appropriate, once we figure this out, to attempt to hire more neural resource facilitators to inform the acquired brain injury population existing in the state, especially to appropriate voc rehab opportunities. Create and support more specialized acquired brain injury employment resources, including the evaluation, technology, applications, et cetera. Then potentially refine a voc-based rehab clubhouse model, as we have one clubhouse in Jacksonville area that's doing a great job, and they are focused on voc rehab, and think that if we can find a way to make that process work effectively for our constituents, we think that would be a great opportunity to enhance the return to work system. And we also would like to spend some time with Ami, because it sounds like she has all the contact information we may need. So we'd like to at least have an initial meeting with Ami to get that taken care of before we proceed with other resources available to us. Thank you.
Terrific. Thank you so much, Denny. And I'll be looking to Maggie next to talk about Iowa.
Hi, everybody. All right. So as you said, we are Iowa. We are fortunate enough that the partners we needed to engage, we all sit under the same Health and Human Services umbrella. And so myself in the brain injury program, we have Morgan Casey, who is our point of contact with the ADRCs. She's on the call, so Morgan, feel free to come off mute. And then Mark Brewer, if I'm saying your last name, I'm sorry, Mark, if I butchered that. He's also on the call and is our point of contact on the Medicaid side. Efforts to date, basically having conversations and trying to figure out like where our opportunities are going to be to expand. So really at the kind of the start of this, but also identifying that we have a lot of opportunities because we have new systems that we're setting up. And so how do we, layer this into some of the requirements that we're going to have with some contractors so that we're, taking advantage of this right away. Barriers, I think one of our barriers is probably going to be really the, we would like to be able to move to the, what do you call it, the point in time claiming, and I'm saying that right. I'm still learning all the terminology, sorry. And I didn't think to bring my notes that I sent in. So I'm going off the top of my head. But really excited that we have buy-in from our leadership. They're very interested in what we're learning here. So that's good. Ideas for improving employment. We really haven't tackled that one as a question among our group yet. Just trying to figure out how to start pulling down the funds. And creating that buy-in from the folks that will be doing the work to draw it down and how that all will work. And then, yes, we will absolutely would love to meet with anybody that wants to talk with us more about this. I think I saw that Mark and and Morgan were both on the call. I don't know if anybody else from Iowa was on, but feel free to jump in with anything I missed or got wrong.
This is Morgan. I would just add, as far as efforts to date, one of the other projects kind of going on right now within Health and Human Services is looking to expand who is an ADRC in our state, which definitely can fit within the work around brain injury and the Brain Injury Alliance in Iowa and the work that they've been doing. And so I'm actually this week updating our cost allocation plan so that it's not quite so specific within our methodology for area agencies on aging, which currently are the only designated ADRCs, but as we expand that, we definitely need some new language in our in our methodology. And so I'd add that as an effort to date that I think complements this really, really well.
Anyone else from Iowa?
I have nothing more to add.
Okay. Thank you, both of you, Morgan, Maggie. I will invite, I think, Missouri to go next. We're not scanning and seeing Maryland on the list, so will that be you, Beth?
Yes, it will. So
Okay.
I'm Beth Dauber. I'm from Missouri. We are still early-ish on. We have our partners that are engaged are really our No Wrong Door partners. So we are in the second year of our No Wrong Door planning, and that's wrapping up very quickly. But we really feel like a lot of this discussion can kind of really fold into those discussions around No Wrong Door. Our point of contact as of right now is Glenda Kramer, who is on this call, and I'm super excited that she's been sitting in on these presentations. And so we've kind of been having some discussions around that. And so Glenda, and I don't want to put you on the spot, but if there's anything that I miss or you have additional insight, please unmute and add that stuff in. But Glenda and then her counterpart, Hallie Malone, when we had our discussion, we did our homework last time. We talked about that we may need to involve the Division of Finance Administrative Services, but we just haven't fully got there yet. So our efforts to date, again, it's really been that preliminary discussion, kind of researching, gathering information, setting the stage, and talking with our No Wrong Door partners around this. One of our biggest barriers at this time is not having any ADRC infrastructure in Missouri, which makes it very difficult to move forward with MAC funding. And then as far as employment, ideally, again, we haven't necessarily got there, but just thinking, dreaming big, ideally we would love to hire or enhance the capacity of front door staff. So again, tying back to No Wrong Door, but if they can offer that person-centered options counseling and have kind of those options laid out for the individuals, that ideally that would potentially improve outcomes. So kind of that resource facilitation and so forth. We would love to meet, just like Alabama, love to meet with anyone who will talk to us. But ideally we would want to have our other No Wrong Door partners involved as well. So kind of having, instead of us just having the discussion and then sharing out, we would love it to be a little bit more collaborative in that sense. Linda, is there anything, or Maureen? I know I saw Maureen was in here too from Missouri. I think that's everybody representing Missouri.
I don't have anything to add. That was a good overview.
Okay, then. Thank you so much, Beth. We're going to go to Minnesota next.
Hello, everyone. Can you hear me okay? Perfect. Okay, so we're in our investigation stage. We have our No Wrong Door already set up with MAC funding. I am part of the Medicaid agency through the Department of Human Services here in Minnesota. So we have our Medicaid contacts taken care of. The partners we have engaged with, we have our Voc Rehab, who's on right now, Holly Sunderman, I hope I said your name okay there, Holly. And then I have Beth Gruby, who is kind of on our employment first capacity building area there. Efforts to date. Now, there are 3 veins that we are investigating. The first one is with our Brain Injury Alliance here in Minnesota. It seems that they have done some trial runs with this before, I think with Steve and Peggy from Nebraska. And for some reason, it didn't move forward. They found themselves ineligible. So I'm working with them to find out how we can make them eligible. And I will be meeting with AMI for that, as well as their chief operating officer. I pulled in the Department of Health to look at their Medicaid numbers of the people that they're serving, because their Medicaid, or I'm sorry, their funding is for the resource facilitation is through our trust fund here in Minnesota, our TBI trust fund. And I want to be able to sort of double that trust fund if we can, or work with that trust fund. And I don't see why there isn't a reason with that. But again, we're in sort of the investigatory stages there. The second piece is backing it up to the Minnesota Department of Health and seeing if, because we have a referral process directly from our hospital registry data to resource facilitation that is serving people on Medicaid, if we can somehow figure out how to get MAC funding over to the Department of Health to sort of boost that process. And again, that's paid through our state trust fund dollars. And then for employment, there were a few things that we were investigating. I really liked the conversation that we had last session about having an employment trained resource facilitator. So I'll talk with the Minnesota Brain Injury Alliance and VR kind of about that. That's pretty cool. But also in 2023, our legislation in Minnesota created sort of capacity building grants for employment, and they're for our lead agencies and our tribes. And that's like $2.4 million per year. And I think it's like a 2 to 5 year grant. And that fund is, again, it's state funded and goes into home and community-based services, so our counties, and so they're serving people on Medicaid as well. So that's a vein of employment I'd really like to explore a little bit more. Yeah, I'm going to need Tommy, even Andrew. On the like left field vein, during our workforce, I think Beth, your Dauber, did I say your name right? Anyway, Beth D, we were talking in our workforce training and development meeting about how we can use these funds to bolster our training as well. So Beth and I am included, will be pulling in a presentation in our next meeting about MAC funding. So you might start getting some extra folks here around the country that are starting to talk about MAC, because everyone is really interested. So that's what I got.
Thanks so much, Eileen.
Yeah, Jill.
Lots of dot connecting. And I keep hearing Ami's name coming up. She's going to be very popular coming up with meetings. And Maria, help me make sure that I'm not overlooking, but I don't think we have North Dakota on. And I believe that is because there was some need to step back and kind of reevaluate a bit. Okay, so then we will go to Ohio.
I know I saw Bree. There she is.
I'm here. Hi, everyone. Happy Wednesday. All right, y'all. So my name is Bree Miller. I am program director for Ohio Brain Injury Program. We are the state agency. I will say you guys have to deal with me today, which is like the B team. John Corrigan and Lauren Hawley, who is our executive director of the Ohio Brain Injury Association, has really been the leads on this. Where we are at currently, we are sending lots of emails and trying to get connected to some of our state partners who are in this work. We had some success at first, and of course we had a turnover in position, and so now it's a wild goose chase. Omni has been really helpful, and we did reach out to her, so she is going to get us connected again. We do know that so far right now, our Department of Health does do MAC. Our Department of Developmental Disabilities does MAC already as well. And our O4As, which is our aging agencies, they do MAC also. And so we're really trying to find out more information. We are lucky that our executive director actually administrated and was one of the administrators for a MAC program in her previous life. So she has some great experience. With that, current barriers, obviously just working sometimes within the state, you get the goose chase of where to go next and who is doing what, especially with turnover in new positions. So we are lucky that we do have some great supporters in each of the area right now for continued investigation. One really interesting thing is we do have a screener in our Ohio Benefits Long-Term Services and Supports helpline, so that's our no wrong door. And we do know that approximately 37 callers per week have a history of TBI, 9 callers a week have a history of a moderate or severe TBI. So we at least have some data for us to back up the importance of MAC, which is great. Ideas for improving employment, we have not gotten there yet. And then obviously I will never turn down help from anyone, you guys know that with me. So of course, any extra help and guidance would always be great. So short and sweet.
Excellent. Thanks so much, Bree. And Carmen, we're going to move to you next.
Good afternoon, everyone. We have an excellent team from Rhode Island, and I will have Patricia Arura help me out after I read this. I already sent the paper, so because it's a lot of information in there, and I'm very thankful of everyone's feedback, and I'm learning from everyone. So Partners Engage, we are very lucky. We have the Rhode Island Executive Office of Health and Human Services. Then we have the Rhode Island Department of Health, Department of Human Services, the Office of Rehabilitation Services. I stand at the Department of Health, and we also have some nonprofit agencies with us, which is the Brain Injury Association, the Ocean State for Independent Living, and the United Way. So we're very lucky on that. When we first started, we were under the impression that Rhode Island did not have MAC. Well, actually, we do. So that was our big learning. Patricia was able to help us with that. We recognize that in MAC, we have different contacts at EOHS, DHS, and BHDDH and DOH. She was able to provide us with the names of all those individuals. I was able to get the copy of the Integrated Service Agency Agreement between the Department of Health and the Office of Health and Human Services, where MAC had been being utilized within my Department of Health where I sit. When we come to about where we are, the current efforts, we're again very lucky that the Rhode Island Office of Health and Human Services have contracted the National Association of State Health Injury Administrators, and they're doing a whole system kind of redesign of the state brain injury. They're doing like an evaluation of the state brain injury services to include the model and implementation plan for programs that meet full range of needs of Rhode Islanders with brain injury. The project is called Rhode Island Brain Injury Services Redesign. The report should be completed for June 2025, which will be very helpful if MAC is mentioned in there. The funding that they utilized was money follow the person from the MRFP. The Rhode Island Department of Health also has a 2-year left of the Traumatic Brain Injury State Partnership Program. So this is where we kind of like stand right now. The current barriers, I sent a list. The Department of Health and Human Services, DHS provided like a whole list of questions that she really wanted to address during this e-learning. One of them is like what mechanisms are in place for monitoring the utilization and impact of MAC funds. How can agencies evaluate the effectiveness of MAC funding initiative and achieve desired outcome? So there's much more questions. So basically in there, I'm saying, yes, whatever help we could get, bring the whole team over. But we also have Patricia, like I said, that she has a lot of information and in some of the questions that she already has, but we definitely need to make sure that we answer all of them. So when it comes about the employment component, one of the main issues that Joseph emphasized on today is that unfortunately with Rhode Island, enough vendors. We don't have vendors that understand how to work with individuals barrier, right? Because we need funding for them, but we also need the agencies, you know, that people are able to contact with. So we need training for the vendors and how to work also with people with brain injury. That's something that he identified. So whether or not to meet with either Amy, Steve, or Andrew, I sent a list of all the questions that she had, and I actually went by departments as well. So that's where we are. I don't know if Patricia, we were able to have a very successful meeting, getting all together. So that was very helpful. And now I'm just going to pass it on to Patricia to see if she has any additional report out.
Oh, Patricia, we can't hear you.
Oh, it looks like she's coming off mute.
Oh, she's having tech issues. Okay, so is there anyone else from Rhode Island that had anything that they would like to bring up? Like I said, we're very lucky we have all the state agencies involved on this, as well as having some the nonprofit agencies as well in here. So that's very appreciative of all of them, of their time, and also your time.
Thank you, Carmen, and thank you for making the connection between the system study and really what is to be suggested and proposed to Rhode Island alongside this initiative. So really excellent. And we are pretty good on time. We think that we'll move to our last presentation now, and that will be South Carolina.
Joyce, I think
Joyce,
I saw you. Yep.
Hey, yeah, can y'all hear me?
We can.
Okay, great. I'm not going to show my camera. I've been traveling and I've been driving. So, you know, honestly, South Carolina, we've done some preliminary investigating, and we have our statewide conference, brain injury conference, at the end of this month. So we've been slammed with that, and also we are finalizing our ACL grant, a statewide needs assessment, and we're having a retreat next week. So I haven't been able to really get as much information as I need to, but as of right now, I know that Department on Aging does not, they are not getting MAC funding. They decided to pursue other initiatives, and Department of Disabilities and Special Needs, which is our lead agency on brain injury in the state, they do not receive it, as well as South Carolina Developmental Disabilities Council. They don't receive MAC funding. I've reached out to one of the Centers for Independent Living and another nonprofit that we feel may be receiving it, but I have not heard back from them. So I think, yeah, after our conference, I need to get with Ami and see who the contacts are with, that are getting funding at this time. So I haven't reached out to Medicaid specifically because we already currently get some funding from Medicaid through a different contract, but I will be doing that.
Thank you very much, Joyce. And thanks all of you for the preparation that you did to, I think, share and help all of the participants that are in this e-learning hear what's working, what the barriers are in different states. Very informative. And I think what we'd like to do now is just see if Steve or Andrew have any observations or follow-up comments. And then after that, we'll move into a brief discussion about remembering what might be reimbursable and non-reimbursable that Maria and Peggy will talk a bit about. And then we'll wrap up with talking about some specific kinds of key messages that you can be thinking about that enhance your elevator speech, your influential remarks to your partners as you go forward. So 3 different areas that we want to still get to before we conclude. We have a half an hour. So Steve and Andrew, anything that you would like to remark on after hearing these state reports?
I added my feedback into the chat, which was in reference to Colorado, in that sometimes the hesitation from state agencies that are overseeing MAC of adding additional agencies is that they think they need to allocate additional funds for those agencies. And in some cases that may need to happen. But in what we're exploring in Nebraska right now is just having contracts that are not funded or minimally funded to be able to add additional partner agencies to have access to MAC. And so that's something in Nebraska. The Brain Injury Alliance of Nebraska receives less than $10,000 in state funding to be an ADRC partner, but they receive over $400,000 a year of MAC. And I'm sure that if the state came and said, we have to take away that $10,000 of funding, they would be fine with it as long as they didn't take away that MAC. And so that isn't really, it's an important consideration when you're communicating out to the different, that this doesn't have to be a funded relationship if that's something that's going to be a major barrier.
Yeah. And I'd also like to add that if you're looking for the funding to go to a public sector entity that's an entity that's not part of a government or government owned, that you always have the option of doing the administrative contract. So if you've engaged somebody at the state who seems interested, but they don't want to set up the whole MAC infrastructure, you could just do an administrative contract in which you specify the types of activities that would be Medicaid related and the portion of the time. Just have some kind of rational way to be allocating that, and that might be a simpler approach for some of you.
And one more thing to add is don't be afraid to continue to follow up. This is additional conversations and considerations for the oversight agency. And in some cases, if they can avoid that, they will avoid that. And so if you can continue to kind of be on their shoulder and making sure that they're hearing you and getting those meetings scheduled, we encourage you to do that. It's really easy for these things to fall off if they're not pursued. And so just continue to do the work that you're doing.
The other thing I might add is just even, and Steve and Andrew, I think you were at the beginning stages of this too, but in our state, we actually passed some legislation to get the ADRC in place. So it took a lot longer, but there's the legislative route also.
All right. Excellent section here. Very much appreciated again for all that you all put into those summaries. So Maria, I will hand it off to you next to introduce the topic of the reimbursable, non-reimbursable. I think Peggy's got an example or more of that. And then of course, Steve, Andrew, you may have some additional guidance and there may be questions as well. So thanks, Maria.
Awesome, thanks, Jill. Just really some quick reminders about things to think about as you're doing your planning. You have heard Ami and Steve and Andrew talk about costs that are reimbursable, and how that works. And then some things that are not reimbursable, overhead, payment that's being duplicated in other places. Just two things I want to just remind you, and then I'm going to turn it over to Peggy because she really, can give you some concrete examples. But keep in mind, reimbursements cannot be made for direct services that are already reimbursable through Medicaid. That, seems pretty straightforward. And there's not reimbursement for expenditures where you're already receiving federal funding. So very important for you to just tuck that in the back of your mind. Of course, all of you are ACL TBI grantees, and I've heard you talk about some of the work that you're thinking about moving towards. And I didn't really hear anything that really raised a red flag in terms of some of the things you guys are thinking about, but I just want you to be mindful of that. Peggy, what do you want to add?
No, I'll just keep it brief, but I think we do resource facilitation here within our state, and that is where the bulk of our work is. And so we break that into, sometimes we provide specific case management services, other times it's information referral. Any of the outreach work that we're doing is also, it can be considered part of that, whether it's, participating in a conference and being an exhibitor, or doing a presentation, or even just, reaching out to agencies and teaching them more about brain injury. As long as we're having some sort of discussion with them along the way about Medicaid, that is reimbursable. And so many of our clients that we're serving are on Medicaid or eligible for Medicaid. So, it includes not only just the time that you're talking to them or in that particular moment of conversation, but any clerical activities that go into that time, being travel time to that, if it's eventually getting to the point where it's Medicaid reimbursable, calls, emails, all those kind of things. Andrew, I'd love for you to chime in here because you're the one who teaches us all the things that can and could and should be. So anything you'd like to add?
Yeah, just a consideration. In addition to the people who are eligible for Medicaid, there's also the people who are at risk of spending down to Medicaid. That's something that has the envelope has certainly been pushed. This has been something that's been approved by CMS in Maryland, Nebraska, and Hawaii, which is those individuals who are not currently on Medicaid, not currently eligible for Medicaid, but who are at risk of if a 6-month nursing facility stay would deplete their income and assets to the point at which they would be eligible for Medicaid, then that's something that is also Medicaid eligible. All the support and time you're spending with those individuals in between the folks that are either on Medicaid or at risk of going onto Medicaid, that's about 90% of the people that our agencies interact with. And so all of that time that you're spending doing information referral and case management, benefits assistance, and counseling, those are all eligible activities that fall under that. And so that's a really important consideration too. Many states do not have, the majority of states do not have that included within their time study methodology. But in Nebraska, that's been hugely beneficial because you're not just working with Medicaid eligible individuals, you're working with those families that are vulnerable. And in Nebraska, for a couple, that's folks who are $150,000 in income and assets, 6-month income and assets or under, excluding their primary home. So if you consider that and you kind of think about your population, it's probably the majority of folks that you guys are working with too. So it's certainly something that we're open to having conversations about if a state is looking to update or expand their methodology.
Awesome.
One quick follow-up, if that's okay. I was just going to ask Peggy, you do a special project, do you not, with vocational rehabilitation that has some of those same resource facilitation functions, but may not fall into this area? Is that correct? Could you speak to that?
Yeah, so we have a special project right now with Voc Rehab. We're utilizing the MyBrain app. Those are some funds we've decided to not. When we talk with Voc Rehab, I think some of those funds that they're giving to us are coming from the federal government. So we have excluded them as being something because it feels like it's a little double dipping. So we just, if it even has a hint of there's some federal funding coming, we just run the other way and don't include that in our amounts.
Does that make
Thank
sense to
you.
everybody? Yeah. Have you got questions about your own activities? We probably have a couple minutes just to take a quick look at those if you do.
Peggy, this is April. So what about meeting with voc rehab counselors or meeting between the TBI professional and the voc rehab counselors? Do you count that as part of time or connection, or you don't count meeting with voc rehab at all? Can you elaborate on that?
For that particular project, I have one resource facilitator just focusing on that one project, and we're getting reimbursed by voc rehab for that activity. Now, I have other resource facilitators that are working with voc rehab for other clients through, and those resource facilitators are being paid for by our trust fund or our Assistance Act. Those folks I allow, if we're having a conversation with voc rehab, they can bill for that. But it's just that one project where we, Brain Injury Alliance of Nebraska, are getting specific funds from VR that we're like, no, we're not gonna.
Gotcha. Okay, thank you.
Mm-hmm.
And that outreach, training, and coordination is eligible. In Nebraska, they do have codes to be able to specifically identify whether the conversations were around Medicaid. So even if it's not about a specific client and it's not like case management, but it's more of a general conversation, those can be coded and considered eligible if Medicaid is a consideration.
Yeah. Another example, like I did a presentation a while back for the Lincoln Police Department. We talk about Medicaid and the clients that we're serving on Medicaid. So that would be an example of something that I would say that was an outreach effort and Medicaid eligible conversation.
Perfect.
Would you be willing to share like your slide or whatever you use, Peggy, on when you mention Medicaid and you throw it into a presentation, like how you do that? Where does it come in, I guess?
You know, it generally fits really well in when we talk about resource facilitation, because usually I do a brain injury 101 for those type of presentations. And it's like, what do resource facilitators do? I usually talk about that towards the end of our presentation. And we build in that, you know, a lot of times we're helping people apply for Medicaid or become, you know, if they're not on Medicaid, we have them determine, you know, we don't determine the eligibility, but we connect them to resources that help match them up if they should need it. So
that's perfect. Thank you for that.
Mm-hmm.
Maggie, have you got a question or are you just ruminating? You look like you were thinking about posing something.
No, thank you. I'm sitting in my car, so I have limited what I can do with my hands. So I'm twirling my hair.
Got it. Anything else before we move on? No. All right, Jill, back to you.
Okay, thanks so much. What we thought we would do next is go into some of the key messages and strategies for return on investment. So as you're thinking about how to plug, you know, the time that's needed for to work with you to make some of this happen, we asked Andrew and Steve if they might give us some thoughts. And so we'll stay with this first slide because that's one of the first pieces of suggestion. And Andrew, I think I'm turning it over to you or to both of you.
All right. And so really before figuring out what your messaging is going to be, also considering what the perspective of your Medicaid agency is going to be in this approach is really key. What are the priorities of your Medicaid agency? What point in tailoring of the messages can you make? In one of the states that we worked with, the Medicaid agency said, "Oh, Mac, this is a really great opportunity for you guys. Like we are happy to sign off on this." Another state that we were working with said, the Medicaid agency said, "What are you guys going to do for us to justify this? Like this is something you guys have to earn." They didn't see it as reimbursement for activities already occurring. They saw it as what are you going to do to demonstrate that you're doing things to support Medicaid. What are you going to look to do to kind of expand what you're doing right now? And so that was a very different conversation in which we had to figure out what data was being collected already that could be used to demonstrate that. What could we add to the data collection to be able to demonstrate the support that's being provided to support Medicaid? And we went through a whole exercise with them to figure out what the reporting might be. So it's really important to consider, the politics of your own state, to consider, what the approach may be for in coming to your Medicaid agency or the operating agency and making that ask. And so on the next slide, we've kind of just shaped some of the messages that the next two slides, we've shaped some of the messages that we've seen as successful in approaching this. So one of the things is if your state is really focused on no wrong door, to consider how you can message around no wrong door. So oftentimes one of the biggest barriers for getting agencies to coordinate in a no wrong door system is that it's unfunded, or maybe your state got a 1-year, 3-year grant to develop a no wrong door system, and then it just kind of ran out and everybody said that was nice and then everybody left. One of the things that you can use to sustain a no wrong door system and coordination is Medicaid administrative claiming is that carrot. And so that's a really important piece, is that, okay, now you're involved in Medicaid administrative claiming. As a result of that, your staff have to, we're going to use this funding in part to develop training, and we're going to use, there could be an expansion of that no wrong door infrastructure as part of that. But also, it really serves as that carrot to making sure that agencies are coordinating, that there's some sort of reason why them not coordinating would create a challenge. Is that Medicaid administrative claiming is something that you're able to say, okay, you're getting funds. Now this is what's required of those funds. And in one of the states we're working with, we put together an RFI for agencies interested in participating in Medicaid administrative claiming, and that goes in parallel with their no wrong door. So it says, if you want to do MAC, then you also have to participate in these other connection points with these other agencies. You have to attend trainings, your staff have to know about other systems within our state. And they've been able to kind of use that as a point of influence for sustaining a no wrong door system. In other states, that what's been successful is we don't want to rely on state dollars. We want more federal funding. Like this, the biggest messaging is around federal funding and getting federal funding. MAC is sustainable federal funds, and it's reimbursement for activities your team's already doing. No additional work needs to go into it. You're able to make it happen and get that 50-50 federal match. It makes, not only is it sustainable federal funding, it makes your state dollars and your local dollars go twice as far. And so you're not only tying it to, you're getting more federal funds, you're also saying, okay, Ledge, if you cut this funding, we're going to not only lose the funding that you're providing us, we're also losing that 50-50 federal match on it. It makes a stronger justification for continuing to have the legislature to continue to support ADRCs and brain injury work and all of the no wrong door network. Next slide. And then if you're going from a state Medicaid agency lens, the state Medicaid agency, they can leverage MAC to enhance the abilities of local agencies to create efficiencies in assisting in the Medicaid system. So like I mentioned, this was a core message in one of the states that we worked with, is that they wanted the ADRCs to demonstrate how they were providing application assistance. The ADRCs were not being funded to provide application assistance with Medicaid, but because they're supporting older adults and vulnerable populations, it was something they ultimately ended up doing. So what we did there is it wasn't an expansion of the role. It was just creating documentation of when they were providing application support to help individuals defer or delay enrollment into Medicaid, or to actually enroll in Medicaid. And so that was a case where the Medicaid agency said, what are you doing to help us? We want you to demonstrate that before we approve this MAC package. And that was something that state was readily able to do because their agencies were already doing it. They just had to figure out how they were going to communicate that over to the state Medicaid agency. So it can be very beneficial for the state Medicaid agency to approve MAC because it's providing additional funds to these local agencies that are already doing this work and supporting those individuals, either identifying alternatives to Medicaid or supporting them with getting enrolled in Medicaid which is alleviating the burden from the state Medicaid agency. So that way the Medicaid agency, the intake unit there, doesn't have to take on these individuals. And then finally, ADRCs can be expanded to a comprehensive network serving all disability populations by leveraging MAC funds. And this was especially true in Nebraska. When we did the operations review in Nebraska, the AAAs were really great at serving older adults. But man, there was not a lot of knowledge outside of the older adult system within that. And the AAAs were the ADRCs. So if I'm an adult with a physical disability, if I'm a kid, if I'm somebody with a brain injury, I call the AAA. Is that really like my point of contact in the community? Is I'm 30, 40, 50 years old. Am I calling the area agency on aging? Is that like a rational point? And it wasn't. We were continuously hearing that and finding that. And so a very natural expansion of the ADRC network was involving these other partners who are already tapped into these other disability communities. And that goes hand in hand with the no wrong door communication as well. But the ADRCs, making sure that they're able to continue the work that they're doing and also to expand it to other populations, because that's the mission of the ADRCs. It's not to serve a single population, it's to serve everyone, all disability populations, and be able to make that happen is often not, you're not able to use the existing infrastructure to make that happen. It needs to be expanded to other agencies. So those are the core, those are kind of the core common messages that we've seen as successful. Obviously, it does need to be tailored to your political environment and in your state, but kind of considering where your agencies are at, what might be most effective is really important as you're going and approaching your state Medicaid or your operating agencies.
Thank you very much. That was very helpful. And we do have a few minutes for questions. If there's anyone in the e-learning that would like to come off mute and ask a question or two, and then we'll start to wrap up for today.
Well, I'll go ahead and ask all the questions. Sorry, y'all. We do have a question related to client data. So if we use an outside company to collect time studies, et cetera, look at case management to bill for all that, do you all, Andrew, and Steve, do y'all collect client data as part of that, or you just collect time worked on clients as far as case management? Can you give us a little bit of information about, because we have a contract with Social Security, so I'm concerned about crossing of client data and HIPAA.
Yeah, and so in the way that it works in Nebraska is that they have a case management system called PeerPlace, which also in Alabama, that's what the AAAs use. They use PeerPlace and FamCare in Alabama. And so that's, they do all of their case documentation within that system. So all client information is stored within there. When we get the time study, what they do is they say, I was working on case management, it was Medicaid related or not. And then they provide a description of what they were doing. So they may say, I was doing case management. I was performing case management. We were discussing X, Y, and Z, and this is the PeerPlace reference ID. And so they're just they're providing an ID number that the supervisor can then go back and double check that that was what they were doing and that they coded everything accurately. We have a 5% sample monthly that the supervisors are reviewing. So they go back, they verify that that's what the staff was doing. They can use that ID. But we have an explicit stipulation that no consumer identifying information, protected health information is included within the time study. So all of that lives in the separate silos, but there's a way to kind of link the two of them by using those IDs.
Thank you.
Other questions? Okay, well, we are at a good time for starting to close our session today. We have about 6 minutes left. What we wanted to mention is that there are some states that are potentially ready to begin better understanding time study details, like the nuts and bolts, a little bit more in depth. And Andrew does this type of training for Nebraska, and he's offered to do that if any of you all would like to take a deeper dive into the time study information. And so the way that you could get involved with that is to simply send a message to Maria and myself, or one of us, and we'll work with Andrew to coordinate a time so that you, if you choose to, can move ahead in the information to really going into details around time studies. So you're welcome to let us know that. I would say sometime over the next 1 to 2 weeks would be great to let us know, and then we'll try to get something coordinated. We are moving into, as has been mentioned, a 6-week pause between this session today and when we come back together again on Wednesday, August 28th. So we're really hoping that this is a time where you can take what you've learned through the 3 sessions and begin to make the additional contacts or put together the kinds of materials or gather the right kinds of data that take you to the next step. So while today was really a status update, what we'd like to ask you to do for the 4th session is to provide a little bit more in the way of your action plan or roadmap. What has been your progress, what's coming next, and then especially what needs you may have, because we know that just because you get to August 28th doesn't mean everything is going to be super crystal clear, and you might not need some additional time or technical assistance. So we'll send out a summary of that request, and we will be scheduling times for your states with Steve and with Andrew, and for other states with Ami. It just kind of also depends on where you're at in your exploration. And we'll be busy. We'll be busy in these next 6 weeks. Maria and I will, our guest presenters will, Peggy might join a TA, I'm guessing, and then each of you will. And we just really appreciate all that you've put into this so far. We're learning a lot alongside you all, because we think what happens out of this e-learning could be so informative and illustrating for the states that are not participating this go around. And that's very exciting. So thank you for doing all you're doing to help pave the way. And I'd like to maybe see if anyone else has a final remark, including Megan with the DETAC, if there's anything in closing that you would like to mention. So maybe Maria, our guests, and then finally wrap up with Megan.
No comments from me. As Jill said, this is fascinating. It's been fascinating listening to how you guys are approaching this. And I know my wheels are turning about how that can apply both to your states and some of the others.
Okay, well then, Megan, anything to send us off?
Yeah, no, I think today's session was great, and I really appreciate all of the state teams sharing out on their work today. Looking forward to our final session on August 28th on roadmaps and action plans. The Google group email and link are still active, and also if you ever need help with anything technical, definitely reach out to our aodemploymentTA@gmail.com inbox. And yeah, I know I was quiet today. Sorry I ran late and I'm a little under the weather, so I'm not on video either. But thanks everyone. And Jill, Maria, if there's anything else to close out, I think we're good to go.
Okay, well, be in touch with any interest in a timekeeping webinar. Be in touch with your needs around some technical assistance appointments. We've captured a lot of that today, and be in touch with any questions. And we'll, stay in touch over the next 6 weeks and plan to see you soon, the latter part of August. Thanks, everyone.
Thank you.